I see that we're being recorded. Today's agenda, I think that all of you received it in advance. Hopefully it meets with your expectations. We will be having, if there are any items or issues that you'd like to let us know, please share with us. We're going to have some committee updates. We're going to have a presentation. And so we really want to make sure that these agendas are reflective of the interest areas that you have. So feel free to reach out to Viviana if there's something we can be doing better or more responsive to meeting your needs. So we would appreciate that. I'm going to ask, as I said earlier, if you could please share your information on the chat. I know several of you, I see over 30 of you had already done it, so thank you so much. Because that way we can also, we're looking at all of the participation that we have, but then all of us can see the different organizations represented here. I wanted to give an opportunity to the members to share any announcements that you wanted to make sure that the group knew about today. Anybody, you could raise your hand or just speak up. I'm good with either one. If you have anything you want to share. Okay, well, I do. I have news. I want to share that Mariela Freire Reyes is now an assistant director at Aging and Disabilities Department. And we could not be more delighted to have her join our executive team. So thank you, Mariela, for taking the risk and jumping from the city to the county. We're really grateful to you. Catherine, you have your hand up.
Hello, everyone. My name is Catherine Thomas. I'm the program coordinator for the local elder abuse prevention grant at Dignity Health Northridge Hospital Center for Healthier Communities. It's amazing to be here today. So the reason why I wanted to say hello to everyone is I wanted to share that in October, we received 3 more years of funding to be able to combat elder abuse. So we have a fantastic enhanced multidisciplinary team to be able to review cases every month. And also we host workshops. I see a couple people on this call are actually part of our multidisciplinary team. So I'm just going to share my information in the chat and just have a shout out that I am a resource for elder abuse. And if you see any sort of elder abuse, to send them my way. But thank you again. It's great to be here.
And Catherine, I want to extend, I would love to reach out to you so that we can figure out how we can collaborate with the Adult Protective Services Forensic Center that our department oversees. We would love to have you be a vital part of the work that we're doing on a countywide basis. I think to the degree that we're all working together, we elevate each other's mission and the opportunities to really be meaningful in the community. Thank you for your success in getting your additional grant. We're very excited about it and for sharing it with us. Anyone else want to share? Okay, so with that, I'm going to move forward because we have a really great presentation that I'm trying to race to get to. I wanted to share, Phyllis asked that we share kind of updates on behalf of the steering committee, sort of broad what we've been doing so that you are up to date, and also to invite you again to be part of any of our committees. The work of LAACHA occurs in the committees. Also, you are welcome to let us know if you want to be part of the steering committee so that we can begin to orient you as to how that works. But I want to invite you, and hopefully you will consider participation because we really do a lot of work in that. As you know, we have been actively implementing a new directions action plan that really has provided sort of the impetus for the activities that you see. It provides the framework that we're using for racial justice. And also, like, for example, one of the things that resulted from all of this work and for your input was that the steering committee dramatically changed in its makeup, because now we've actually have included community members and also developed a process for that's more formal for the election of the leadership of the steering committee. And again, that was through your input and your comments that this change occurred. We are also continuing to use your response to the 2022 membership survey that help us to identify our action priority areas. As you know, the 3 priority areas we are committed to working around are family caregiver services and support, housing stability, and economic security. A lot of the activities are centering on are really mobilizing around those particular areas. For example, our Capacity and Resource Development Committee has been implementing and developing a social isolation media mini campaign that they launched in June. And also, they launched the Get Ready LA online training platform in October. And I want to invite our co-chair for that committee, Rosa Peña, to please give us a quick update. Rosa.
Dr. Trejo, and hello everyone. Nice to be here. So I wanted to give you an update and thank you to all of those that have already signed up. And we began taking the online training offer through the Get Ready LA online training program. So after reviewing the data provided by our partner, Nonprofit Ready, the data report indicates that 42 LAACHA organizational members have registered and that 36 members have already taken various trainings. So we would actually like to congratulate each and every one that took the time to take advantage of this wonderful and valuable resource. So Brandon did some follow-up calls and was able to identify some of the agencies that have already signed up and are taking the trainings. So I'm going to just name them real quickly, if I may. So Shannon Jones from Blacks in Motion Community Development, Martha Miranda from Human Good, Kimberly Reyes from Office of Women's Health, Maria Galina from Motion Picture and Television Fund, Chrissy Sanchez from YWCA of San Gabriel Valley, and Linda Haley from MPTF, Karen Rizai from Long Beach Gray Panthers, and Erica Goff from County of Los Angeles Department of Public Health. So to continue the efforts to enhance the LAACHA member capacity to address organizational sustainability, access government funding and resources, build workforce capacity, we'll be convening back the participants that were at our last meeting in October and really explored the development and implementation of a pilot project. And the goal of the project will be to track and measure progress towards the established goals. So access the training gaps that may be there, identify and implement solutions for closing those gaps. So if you or someone at your organization is interested in being part of the project, please send an email to Viviana Criado, LAACHA Project Director. So we hope, to have more information to share at the next LAACHA meeting, quarterly meeting. So thank you, everyone.
Thank you, Rosa. How exciting. And thank you, members, for actively engaging in the platform. We really believe that it's very high quality information being provided free of charge. So thank you for taking advantage of it. And remember, you can engage and invite the rest of your staff to also participate. We want to, encourage you to do that. The next committee that I need to acknowledge is our Innovation Committee, which also houses our Technology and Digital Inclusion Subcommittee. In June, the committee hosted the 3rd Annual Innovation Award. Hopefully, many of you were there. And it was such a joyous event hosted at What's Labor. I remember it was lovely. And we had such incredible people being recognized that I hope that, that you've looked at that information. I know Viviana was featuring it in our postcards and really trying to elevate the visibility. So we really want to, again, acknowledge and recognize those incredible folks who won the awards, and we're very grateful for their continuing participation. Also, the Technology and Digital Inclusion Subcommittee partnered with the Long Beach Gray Panthers and the What's Labor Community Action Committee and the San Gabriel Valley YWCA, and they've been implementing 3 technology pop-ups. I happened to go, I think, to the first one, right, Viviana, in Long Beach. It was a blast. I had a great time. I taught all the Gray Panthers how to growl. And they told me that now they're all growling at their meetings. It made my absolute year to hear that. And so an incredible group of older adults that are really ready to be mobilized. And I think, thank you, Viviana, for seeing the incredible opportunity, engaging with them, and really bringing them as part of our solution to encouraging older adults to be more active in their learning for technology devices. The committee, like I said, has been very much working in that space. They've also been incredibly supportive of the development of the California Coalition on Family Caregiving. We want to recognize and thank Dr. Donna Benton for making sure that we're an integral part of that state level work. Thank you, Donna, for making sure that we're part of that conversation, because it's an important conversation at the statewide level. Right now, I'm going to request that Cameron, please drop the link for the coalition on the chat so that all of you can have a copy of it, look at the work. And also I want to invite you or any member of your staff or your environment to please consider joining and be active participants. As we all know, caregiving is a major issue in California, and we need to be at those tables having those conversations, or things will not change in the ways that we can contribute to making sure that they change correctly for the communities that we work with. So thank you to our committee members in the Innovation Committee for the incredible hard work that they've engaged in. Next, I am going to give you a brief update on the Racial Justice Committee. They are currently working on the development of the racial justice training. They're also working with the National Patient Advocacy Foundation. They co-convened an educational workshop on shared decision-making, which was, I know that's been an incredible amount of work. Thank you to all the committee members for really being an active part of that. It's also providing an opportunity for funding that has been secured. And we're looking forward to continuing this partnership with them in the future and sort of expanding the opportunities for folks to provide input to them. Incredible group of people. The group, our Racial Justice Committee also continues to try to identify funding opportunities to evaluate the Shape to Fit program. So if you have any information about potential grants or anything like that that could work in the evaluation of an evidence-based community activity, let Viviana know so that we can follow up. You know, sometimes you may come into contact with information that the rest of us don't see, and it may not even be what you're seeking, but you could say, oh, you know what, Viviana might use it. I can tell you, I overwhelm poor Viviana with my emails, constantly sending her things that I find in my travels in the internet and other places, because I want to make sure that she shares it with all of you, and that she understands that it's available for any of the partners in case they need it. So again, I want to encourage you to share information. Next, it is my absolute pleasure to introduce Ellen Edem, who's chairing our Outcomes and Evaluation Committee, who is going to provide us a brief overview of the work that group has been doing. Ellen? I saw her.
Yes. I'm here. Hi. Hi to everyone. Welcome. So this is a really exciting day for us, that those of us that have been working on some aspect of the Healthy Aging Dashboard for several years. So I want to share kind of our enthusiasm that we have now been able to, you know, today we're in the actual launch of our Healthy Aging Dashboard. And before we get to kind of all the particulars, I just wanted to step back a minute and kind of just go through, you know, just very quickly the purpose of our Outcomes and Evaluation Committee. So, you know, our ultimate goal is to help reduce disparities and to improve outcomes for diverse older adults. And that's through both identifying and tracking and reporting and the evaluation, which we haven't really gotten to yet in the committee, of the ethnic and culturally responsive, innovative interventions and programs that you all are doing. So part of this is, you know, we want to identify potential areas of improvement, meaning like, what does the data tell us? What can we learn about what needs to be improved? You know, do we want to develop those valid and reliable outcome measures, identify the strategies and performance measures that can help reduce those disparities, and then really to develop the framework for planning and managing and implementing the the dissemination of the LAACHA evaluation activities. And then, of course, we're part of the whole action plan and created the short and midterm and long-term recommendations. So thank you to all of our committee members. They have been, exceptional. So just want to call them out. Dr. Catherine Kitzman from UCLA Center for Health Policy, Dr. Susie Baldwin and Chris Lamb from our Office of Women's Health, Christina Capul with the San Gabriel Valley YWCA, and the team of IT folks from the LA County Aging and Disability Department. That's Ivan Pacheco and Anahit, and I'm sorry if I butcher your last name, Damlamian, forgive me, Jorge Merchant and Sebastian Cordova Jr. So thank you to the committee members. You have, for all of your work over the last couple of years. So the priorities that we've had in the committee. So the first one has really been twofold. One is the planning for the launch and the what will come after. This has kind of been the main focus for the last period. But the second part is really developing this evaluation framework. And what we're trying to do kind of in the background is look at some of the research models for conducting evaluation that's based on kind of principles of community involvement, that it supports innovative approaches and really advances racial and health equity. So part of what we want to try to get to is how do we assist our LAACHA member organizations with evaluating some of the great innovative projects that are being done out in the community. Excuse me. And so we hope that we're able to say more on that, and that that more has transpired in the evaluation component of this soon. So the team successfully worked to transition the dashboard from the Tucker Seeley Lab to the Department of Aging and Disabilities, so that today we can actually launch that Los Angeles Healthy Aging Dashboard. And we want to thank, immense thank yous to Dr. Tucker Seeley, who you're going to hear from next, for his leadership in designing and developing the dashboard, and to the members of his lab, which is Dr. Wei-Su Tang, Lois Angelo, and our LAACHA intern, Morgan O'Donnell, for helping with the implementation of the phase 1 of the dashboard. And that got us here today. Thank you for your tremendous efforts. And now it's in the hands of Aging and Disability IT team and Dr. Laura Trejo for making the whole thing possible from here going forward. So thank you to Laura and team. So I'm going to go back now to Laura, who's going to take us to begin the whole launch component of the dashboard.
Well, thank you, Ellen, and thank you for the incredible work of the committee. I mean, as you can see, that is a hard working group of people. Thank you, Ellen, for the due diligence that you've been doing for such a long time. I am really excited today. I have this short list of about 10 things that I need to change in the world that I have no control of how I am going to do it, but I know that they have to happen. And in the 1990s, I put in my list of my 10 items that I wanted to have a scorecard, an index of well-being for older people in LA County, because they launched one for children. And when I saw the Children's Wellness Scorecard, I was enamored with the incredible amount of work that the Children's Planning Council did, and began to really think about how could we do that for older adults? We have to figure it out. But when you don't have staff, money, contacts, information, you just kind of have it on the to-do list and you keep going, I'll figure it out. So I've always trusted the process that when I put something on my list, I'll figure it out. And, in about 2015, Bill Vega from USC Roybal Institute came to me and he said, Laura, we're looking for potential ideas of projects that the Roybal Institute could embrace. We had been working with interns at that point to kind of develop an understanding of what data sets were available, trying to, do it with interns who are amazing. If you don't have interns, find interns, they're brilliant. Because we were working with interns in predominantly social work and gerontology, to help us understand what was out there. Then Bill came along with his team. And the next thing we know, in 2015, they created for us the Healthy Aging Report. If you haven't seen that, it's on their website. I encourage you to look at it, because that really became the framework of what you will see on the dashboard right now. It was, I handed the report to Reggie, and I said, Reggie, in paper, but this is the dream. The dream is to transport this into a digital format. And could you see it? And he's like, yeah, I could see it. And began to really work with us. You know, as you know, we also had the Purposeful Aging Action Plan that had a lot of data in it. Again, it's iteration. You know, we had a focus, we had a plan, and we were trying to find ways that we could implement the sharing of information so that all of us in the community can benefit when we're doing strategic planning, when we're doing advocacy, when we're trying to do program development. And that's really at the core of this information, is for your use in the work that you do. We want you to be data informed and have it as a backdrop to the kinds of decisions that you're making. So, you know, part of it was, how do we centralize data? That always came up as the major issue. Who's going to be responsible? How will we do it? And then, like I said, you know, Reggie stepped up. The Tucker Seeley Lab at the Gerontology School at USC was willing to partner with LAACHA and with the LA City Department of Aging and the Los Angeles Foundation on Aging to really look at how could we actually take this into the model that you will see. I am incredibly grateful to Reggie for his vision, for his dedication, and just really being such an incredible partner to us, to kind of think about how to do this. You know, he never said, how will we fund it? It was like, we need to get it done, which is always a wonderful thing when you find a partner that believes in the vision of what you're trying to do. And so, you know, we figured it out on the way, he and I, and everyone else. So grateful to that. Today, he is going to be sharing with you a presentation about the Los Angeles Healthy Aging Dashboard that will live on our website. And I want to acknowledge, recognize, and appreciate the team at the Department of Aging, Ivan Pacheco and his entire staff, who have been working absolutely tirelessly to get this done for Viviana in this time frame, because they knew this meeting was happening. You have to understand, we're building a department. So to ask people, in addition to that, would you mind taking an additional responsibility of this really high profile activity, is a lot to ask. But Ivan is an amazing leader, and I want to thank him also for his dedication and his passion for older adults and persons with disability in our community, because it's really through him and his team that you see this incredible outcome in the work that you'll see today. So thank you to our folks at Aging and Disabilities for really, you know, taking this and running with it. We're very grateful. And so with that, it is my absolute pleasure, as always, to introduce one of my favorite people, Dr. Reginald Tucker Seeley, who is the principal and owner of Health Equity Strategies and Solutions. He is a member of our steering committee, and Reggie is also a former chair of our innovations committee. So Reggie, without further ado, thank you, thank you, thank you, and we look forward to your presentation.
Thank you for that introduction, Laura. It's like, I don't have any children, but I feel like, you know, we've been talking about this for so long, like to see this come to fruition. It's like my baby is being introduced to the world, or like a coming out party, or something like that. So thank you all so much for coming today. This has been, I think Laura mentioned the story of sort of handing me the report. I think when I first met Laura, she was like, "You're going to be my partner." And I was like, "Of course, tell me what you want to do." So this is really exciting to see this come to fruition. All of the folks that have been mentioned, a big thank you to all of you. I have a list at the end of the slides of a list of thank yous, and I apologize if someone's name is not on the list, but thanks to all those that have been mentioned. None of this could have been possible without all of those names. So, as Laura mentioned, my name is Reggie Tucker Seeley. I'm the principal and owner of Health Equity Strategies and Solutions, and also a LAACHA steering committee member. And I'll talk today about the Los Angeles Healthy Aging and Chronic Disease Data Dashboard, background and development. let's see if I can move some of the Zoom controls there. So an overview, I'll give you a little bit of background about me for those of you that I haven't met, give you a bit of background on dashboard development, talk about dashboard content, talk about next steps, and we'll also do a breakout group exercise where you all will get to navigate the dashboard a little bit here today as well. So about me, I recently started my own consulting company called Health Equity Strategies and Solutions. I am so excited about this new endeavor. But before launching out on my own, I was the vice president of health equity at Zero Prostate Cancer. Before that, and where this work originated, I was the Edward L. Schneider Chair and Assistant Professor of Gerontology at the Leonard Davis School of Gerontology at USC. Before coming to Southern California, I was on the East Coast. I was an assistant professor of social and behavioral sciences at the Dana-Farber Cancer Institute and the Harvard School of Public Health. And in between those two roles, I had the esteemed privilege of serving as a Robert Wood Johnson Health Policy Fellow, specifically with the placement in the United States Senate, working for the late Senator Dianne Feinstein. So let's dive right in. Some background on the development of the dashboard. So as Laura mentioned, and I put the link in the chat, for the 2015 Healthy Aging Report. And you'll recall in that report, it listed chronic conditions by race, ethnicity. That report looked at chronic illness over a decade in the area, and also noted that life expectancy at age 50 was different across the various places here in the LA area. However, as Laura and I began talking about this report, I realized there was no process or mechanism or pathway in place to update the 2015 report. Now, I've been involved in several city or state level reports, and I will recall something I heard when I was on a commission in Rhode Island, that someone was lamenting about all the reports that they had created, and they said that most of those reports ended up on what they called the shelf of shame. That is a shelf where no one looked at them after they had been created. And so that really stuck with me in terms of thinking about the ways in which we can consistently provide resources to people in our community about what's going on in their community. And so Laura and I began to brainstorm around the ways in which we could update this report and provide a sustainable way to provide this data to the Los Angeles aging community. So we landed on creating a dashboard. So what is a dashboard? A dashboard is a way of displaying various types of visual data in one place, and usually a dashboard is intended to convey different but related information in an easy to digest format. Now, this easy to digest format is the key component of a data dashboard, because that's one of the reasons why you use a dashboard to present data. That is, it is accessible, so it's easy to navigate, easy to read, but it also provides an easy mechanism for updating data so that you can evaluate trends. And the main goal for our data dashboard is that this will be a data management tool that visually tracks, analyzes, and displays the prevalence of specific health indicators and disparities in those health indicators to monitor the health and well-being of older adults in Los Angeles County. Now, a key component of this dashboard will be a focus on, or an inclusion of, social determinants of health data and socio-demographic disparities. Now, this is our first public draft, and we're open to feedback and how to make this data source more useful to the aging community in Los Angeles. So where is the dashboard housed? As was mentioned at the beginning, the dashboard now lives at the Los Angeles County Aging and Disabilities Department website. So if you'll start here at the website at ad.lacounty.gov, if you scroll all the way down to the Find Out More section, there is a link there that says Healthy Aging LA Dashboard. And if you click that link, then you get to the data, that Los Angeles Healthy Aging and Chronic Disease Dashboard. And when you click that link, this is what you see: the Los Angeles Healthy Aging and Chronic Disease Dashboard with the logos for all of our respective organizations, and then a brief overview of how this dashboard came to be. That is, the Healthy Aging and Chronic Disease Data Dashboard was a collaboration between my research lab at the Leonard Davis School of Gerontology, the Los Angeles County Department of Aging and Disabilities, and LAACHA, the Los Angeles Alliance for Community Health and Aging. and that this is an update to the 2015 Healthy Aging Report. And you'll see on the left there are some tabs, and those tabs are the health outcomes and the demographic characteristics that comprise the content of our data dashboard. So what does the dashboard include? So for physical health, we have prevalence information on diabetes, hypertension, self-rated health. For mental health, we have depression and social and emotional support data. For health behaviors, we have fruit and vegetable consumption, physical activity, and smoking data. For healthcare access, regular source of care. For social determinants of health, we have food insecurity. And then for demographic characteristics, we have age, education, gender, income, marital status, and race. Now, this has been a collaborative process in terms of deciding which of these health outcomes to include, because of course, you can imagine that we could have chosen a myriad of health outcomes to include here, but our steering committee and the team working on this selected these health outcomes primarily for reasons related to having the data for these specific having complete data for these specific health outcomes. And we first previewed the data dashboard content and structure at our LAACHA meeting back in September of 2021. And so thanks to everyone who prior to that meeting, at that meeting, and following that meeting, who have continued to provide us with feedback and to inform the information that is a part of this data dashboard that we're presenting today. So as you will recall on that landing page, on the left there, you saw the buttons for physical health, mental health, health behavior, healthcare access, social determinants of health, and demographics. And so if you click that physical health button, what comes up is what's here on the right, where you see physical health, and then you see buttons for diabetes, hypertension, and self-rated health, and also how those are defined for the data that's used in the data dashboard. So let's say you clicked the diabetes tab, you click the diabetes tab, and then this comes up where you see across the top are demographic characteristics of age, education, gender, income, marital status, and race. And so age is the default here. And you see there, you see year in that first column. So we have data from 2015 and 2018. You have an indicator, which is diabetes, then you have a survey item, and then you have response options, and then you have the prevalence of individuals who said, have you ever been told by a doctor or other health professional that you have diabetes or sugar diabetes? And so for 2015, those who said no was 81% in 2015 and 79% in 2018. And those who said yes, 19% in 2015 and 21% in 2018. And if you go further down, you'll see that those responses are then sorted by age. And so all of the individuals that are part of this data set are age 50 and older. And so these are the response options and the prevalence numbers for those particular age groups. And then also we see the bar charts there indicating the prevalence numbers. So as I noted in the upper left-hand corner, you see year. And if you click on that box where it says 2015, then in the middle section there, you will only see the 2015 data. So notice in the previous slide, in the middle section, you see 2015 and 2018 data, but that's because in the upper left-hand corner, 2015 and 2018 have not been selected. Now, if you select 2015, then you only get 2015 data, and you only get those bars for 2015 at the bottom. So that is a way to just get the data for the year. If you were just interested in 2015 data, notice at the top, we still have 2015 and 2018 data in the top row. But as you go down on the page, you only get 2015 data if you select that particular year. So in looking at that page, what is the indicator? So the indicator is the variable or the health outcome of interest. So that would be diabetes or sugar diabetes. That is the indicator. And then what is the survey item? So that is, how was that indicator measured? And that was measured by asking a question: have you ever been told by a doctor or other health professional that you have diabetes or sugar diabetes? And then what were the response options? The response options for the respondent was to say yes or no. And then for individuals who said no, again, for 2015, it was 81%, in 2018, 79%. And those who said yes, it was 19%, and then 21%, respectively. Now, so that is sort of a navigation, that is a navigation of the physical health variable. So if we go back to the main page, again, we have physical health, mental health, health behavior, healthcare access, social determinants of health, and demographics. But if we select social determinants of health, we have one social determinants of health variable, and that's food insecurity. And food insecurity is defined here as the lack of consistent access to enough food for an active or healthy life. And then it's listed here as food secure or food insecure. And here the survey item is the household food security scale. And in that scale, there's an indication of whether one is food secure or food insecure. And here I've selected the race variable to highlight food insecurity by race. And so, but notice that there's no year selected, here. So we see the data both for 2015 and for 2018. And so, let's see, someone's trying to get into the room. And so in the middle section here, we see the indicator, which is food insecurity. And then we see the year, and then we see each of the racial groups. So we see African American, American Indian and Alaska Native, Asian and Native Hawaiian or other Pacific Islander, Latino, other, and white. And those are the percentages of folks who indicated whether or not they were food insecure or food secure. So this is just a screenshot of the page, so I can't scroll down. But on the actual page, you're able to scroll up and down so that you can see what is the prevalence of individuals who are food insecure or food secure for the various racial and ethnic groups. Now you'll notice that some of the numbers some are colored yellow or orange and some are colored red. Now for the text in orange, those cell sizes are really small. And so they may not necessarily be appropriate for planning or policy purposes. And then for the ones in red, those are unstable estimates where the relative standard errors are really large. So those are also some sampling issues. And so for the ones that are highlighted, then that's some issues around, those present issues of relatively small sample sizes and may not necessarily be useful for policy or programming efforts. So what is the data that we use to populate our data dashboard? So we used the Los Angeles County Health Survey. And this is the Los Angeles County Health Survey, is a population-based telephone survey that provides information concerning the health of Los Angeles County residents. And there's the website there that gives you the information on the Los Angeles County Health Survey. And from that data source, we selected data only for respondents aged 50 and above. So what are some potential uses of the current version of the data dashboard? Well, one, to inform LAACHA partner programming efforts and grant applications, as has been mentioned in the conversation so far. If you're writing a grant application and you need to know what's the prevalence of diabetes in Los Angeles County, or what's the prevalence of physical activity behavior or physical or smoking behavior, this data dashboard can give you that information. Also demographic information on the older adult population. And we only have the one social determinant of health data in there so far, but also data on the social determinants of health on the older adult population in Los Angeles. Now, we've mentioned that one of the uses of the data dashboard will be a focus on racial disparities. Now, that is not there yet, so that's a next step in terms of what we plan to add to the dashboard. But as we know, there are differences by race in terms of life expectancy, diabetes, difficulty accessing care, not having a regular source of care. So this data is from the Center for Health Equity, a call to action plan. And that report highlighted the differences in addition to the healthy aging report, but it also highlights the differences across these other health outcomes as well. And so the next steps in creating and adding a health disparities component to the dashboard, well, first we'll have to calculate those disparities, and there are multiple ways to calculate disparity. So one way is an absolute difference, where you just take rate 1 minus rate 2, and that's your rate difference, and that tells you that there is a disparity. So for example, if you have a white group and a Black group, or a white group and the Latino group, and you just subtract those two rates, that gives you the absolute difference, and that is a measure of disparity. But you can also calculate a rate ratio, where you put one rate over the other rate, and then divide, and that gives you your rate ratio, and that is your relative measure of disparity. But note here, for absolute difference and rate ratio differences, those only let you calculate a disparity if you have two groups. Now, thinking about things like education, you might have different groups. For example, you might have those who completed high school, those with some college, more college, graduate degrees. Or for race, and ethnicity, you might have multiple racial and ethnic groups that you want to calculate a measure of disparity. And that's where this sort of math-heavy version of an index of disparity measure comes in, because a measure like the index of disparity, to calculate that tells you the amount of variability that you have in your particular measure from a particular reference. So if you have a reference group, that is the group, and that reference group can be the best rate, it can be a target rate, sort of what you're working towards, or the average rate among all the groups. And then what the index of disparity tells you is how much all of the groups vary from that particular reference group. And so in adding these measures of disparity to the data dashboard, we can provide the users with either an absolute rate, an absolute measure of disparity, a relative measure of disparity, or an index of disparity. Now, it can be quite complicated in sort of calculating these measures, and sometimes it can feel like, oh, it's a black box if you don't know, sort of what goes into that calculation, who was the reference group, why those groups were used as the reference group. So I've written a couple of papers sort of on this topic, specifically about the importance of being, explicit about your methodological choices here. So that is being explicit about who is the reference group and why are they the reference group. Is it the best group, or the average group, or the largest group, or the group with the most social advantage? So as Ellen was talking earlier about sort of this evaluation framework, it's going to be very important that we are explicit about how we're making these decisions, so that folks are aware about sort of who are we comparing all the other groups to when we talk about disparities. And it's also important that we're able to communicate those choices across various communities. So are we talking to, healthcare providers or researchers or community members or patients, making sure that whatever method we choose, that we're able to communicate that to our respective audiences. Specifically, there's a paper, and I have this citation here, happy to share it, but this author really has informed all of my papers in this area, and actually informed those previous slides around how important it is to be explicit in those methodological choices. But it's also important that you actually have the data to calculate those differences. So in order to implement health equity for older adults, first, the disparity in the outcome of interest must be measured, and it must be quantified over time. So that is, we need the data, and we need the data over time. However, there's no consensus as to the most appropriate methods for measuring or monitoring changes in disparity over time. So whatever method we choose, the recommended practices are that you are just explicit about your methodological choices. So of course, this process will present additional challenges. One is, how do you define disparity? Are we going to focus, and which disparity would we focus on? So as you saw at the top of the page, sort of once you got to a specific health outcome, we had several demographic characteristics across the top. So you could you could determine differences by race or ethnicity. You can determine differences by income, or so socioeconomic status, such as education and income, but also geographic disparity is possible if we have data by place. And then the notion of when is a difference a disparity? So how is that difference quantified? How is that quantification reported and then suggested to be used? And then for health equity, and we've talked about this a lot in LAACHA in terms of, how we define health equity, and if health equity is, one's ability to achieve, one's best health possible, and to, address issues that are avoidable and that are unfair, making sure that you have the evidence on those barriers being indeed avoidable and unfair. And then when is the difference actionable? Should you focus on the difference or improving the outcome of the worst off group? And then when reporting those differences, if you're reporting those differences, people are going to know that those differences exist. And so note, sometimes those differences get ignored, and the implications of ignoring those differences. So our next steps also include deciding what additional data do we include. We've spent a long time trying to find the best data source that would provide data on the older adults here in Los Angeles, but also thinking about, what new data would we include? What would those data sources be? Would we only focus on population level studies like the Los Angeles County Health Survey, which allows us to make inferences to the larger population in LA County? Or would we use non-generalizable sources? So that is smaller data sources that might give us some data on some outcomes that might not necessarily be in the data sources that we have. And so these are all questions that we will decide as a group, as LAACHA, as we continue to build this data dashboard, but just wanted to raise those again as we continue to build this amazing tool. So now we're going to go into breakout groups, and we're going to let you do you navigate the data dashboard. So, but before we go into groups, I'm going to sort of help you get to where the dashboard is. So here is the link to the Los Angeles County Aging and Disabilities website. So go to that link, and then you'll scroll down to the bottom of the page, and then you look for Find Out More. And when you see the Find Out More, click on Healthy Aging LA Dashboard. And then there are some banners at the top, so you'll have to roll down. You'll have to scroll down a bit once you get on that page, and then you should be on the landing page for the LA. My pup is trying to jump on my leg here. For the Healthy Aging LA Dashboard. And so here are the breakout instructions. And I think we're going to go into groups, if that's right, Viviana, and then these instructions will be put in the chat. But I'm going to walk you through what you're going to do in your breakout session now. So you're going to have about 15 minutes for this activity. And as a group, please identify someone who's going to be the facilitator or a note taker. This can be the same person if you like. And each of you will take about 5 minutes to visit the Aging and Disability Department website and navigate to the Healthy Aging Dashboard. And then when you're done, then come back to your group and then talk about your experience in navigating the dashboard. You'll have about a couple minutes to do that. But for this exercise, what we want you to do is select a physical or mental health or health behavior outcome. So remember, we have physical health, mental health, health behaviors, we have social determinants of health. So feel free to pick any of those outcomes. And then what is the indicator? What is the survey item used to capture that indicator? And then what are the response options? So remember, for diabetes, that indicator was diabetes or sugar diabetes. And then the survey item was, has a doctor ever told you that you have diabetes or sugar diabetes or something like that? And then the response options were either yes or no. And then select the demographic characteristics. So remember, the default is going to be age, but there are other demographic characteristics that you can select. And then select a year, either 2015 or 2018. And then what is the prevalence of the outcome you selected across the categories of the demographic characteristic you selected? And then if you chose 2015, then do it all again for 2018, and then you'll report your results back. And then you'll receive a 2-minute warning before your breakout room closes. And then we'll come back as a group all together and just have a couple people share what their experience was like navigating the data dashboard. So I'm going to,
JT,
yes.
before we go into breakout, it
Uh-huh.
seems that there are a couple of people that have questions. I don't know if you want to use some
Oh.
time to answer questions before we go to the breakout. Would that be okay, or you rather do it later?
There seems to be, I'm not sure how many questions there are. So if I would rather us sort of go into the breakout groups, because yeah, then we will have time for questions at the end. But I can, if there aren't
Beautiful.
that many.
Yep. Yep. One of the questions has been answered. I just got a message here. Good.
Okay.
So let's go for the breakout rooms. Excellent. And Donna is on the task.
I am very sorry. I cannot follow what's going on.
Oh, I'm sorry. Let me
Yeah.
stop and share. Stop sharing and see who. So someone said that they couldn't follow.
Yes, I did.
That is
Bernita
Bernita.
Walker.
Okay. So Bernita is, did you make it to the Los Angeles County Aging and Disabilities website?
I did, and then
Okay.
I was interrupted, so I got totally thrown off.
Okay. So then if you'll scroll all the way down to the Find Out More. So scroll all the way down to the bottom and you'll see a section called Find Out More.
Okay.
And
Thank
then there is a LA Healthy Aging dashboard.
Right. Thank you so much.
You're welcome.
Dr. Tucker Seeley, I also wanted to point out that when you get to the dashboard landing page, if the screen is too small, there's an arrow up button at the bottom, which makes it into a full screen so that people can see it a little larger. Hopefully you can see it, or I can share my screen real quick so that people can know what I'm talking about. But the share my screen has been disabled for me. So I can't do that. But if you want to share the screen on that,
sure.
and on the bottom there's an arrow that makes it into a full screen, which is one of the features that was added by the team.
It's to the right.
Correct.
Go to that.
Donna,
Are we all back?
are we all back? You give us 1 minute. We need 15 minutes, Donna.
Okay. So Ivan, I'm going to share my screen so that we can.
Sure. So if you scroll down just a little bit, a little more, right below, there you go. So you see that two, a little lower to your right, there's
Right,
the two
right
arrows. Yep. If you click on that, it changes it to full screen.
Exactly.
Right.
Great.
And then now you're on full screen. And if you want to get back to the other page, you just hit escape and you're back to the other page.
Great.
So this gives you a bigger view.
Oh, fantastic. Thank you, Ivan.
And I also wanted to point out that Sebastian was able to add the links. So all these are clickable. So if you want to get to any of these sites, you can, and it takes you directly there.
Great.
If you click on those links.
Okay.
Yep.
Oh, on the
Yep.
for
Yep.
the individual partners.
Correct.
Great. So as
So if
you'll
you need
see,
to-
sort of, yep, on this main page, Purposeful Aging, the LA County Aging and Disabilities Department, LA Foundation on Aging, all of those are clickable now.
So where is the find out more?
So the find out more, if you're on the Aging and Disabilities website, scroll down all the way to the bottom and it's on the right-hand side. And there should be 3 items under the find out more. One of them is Healthy Aging LA dashboard. And you just click on
Okay.
that.
Got it. I was trying to scroll on the shared image. Find out more. Healthy aging.
Last question. Are we to read all of that before we go into the room?
I'm sorry, to read all of what?
What we're on the dashboard. I keep getting kicked back to join the room, and I'm haven't had the opportunity to finish reading what it is that you want us to do.
Oh, okay. So I will put it in the chat.
Thank you.
You're welcome.
Find more about aging dashboard. Nah, it keeps coming back. I'm still. Yeah. Dashboard. Okay. It's kicking me out.
So Donna or Viviana, how much time do we have left?
Okay. Here we go.
Reggie, that was wonderful. Thank you.
Yes, I think when everyone comes back, I'll walk people through like the actual page, and then we'll take some questions and then we'll wrap up.
Thank you.
Okay. Mhm. Okay.
Okay, I'm gonna give a 2-minute warning. Is that okay, Reggie?
Or do you want
Yes.
more time?
Yep. That sounds great.
Okay. Hello, everyone. This is your 2-minute warning. Hello, everyone. This is your 2-minute warning. Everyone's coming back in about 5 seconds.
Okay.
Yeah. Oh. Okay.
Great. Welcome back. So I'm going to share my screen. And so you should have gone to this landing page. Let me scroll down here. There's at the bottom, there's open in full screen mode, which Ivan shared with us before you left for your groups. And then this is the main page. And so what we asked you to do is to select one of the health outcomes here. So something from physical health, mental health, health behavior, healthcare access, social determinants of health. So I'm going to select healthcare access. And so then that gives us the variable usual regular source of care. So here we just have one variable to choose from. And then we asked, once you got to this page, to tell us what the indicator was. So the indicator is regular source of care. The survey item is when you are sick and want advice about your health. Is there one particular place or health provider to whom you go to most? And then the response options for that would be either yes or no. And we see here that the prevalence for people who said no in 2015 was 13%, and the prevalence who said no in 2018 was 10%. And then if we choose by education here, we see the education level. So we see college, high school, less than high school, some college, some college or trade school. And then the prevalence numbers here for 2015. And then if we go all the way over to the far left and select a year, then we only get that information for 2015 in this middle section here, and also in the graphs down below. Now notice you can switch between education, if you want it for income or marital status or race. All of that is available here. And then to go back, return to healthcare access, and then return to the main menu, and then we're back at the beginning. So I'm gonna stop sharing this screen and then go back to my slides as we will take some questions and comments from folks. Let's see, let me share my screen again. And so if anyone would like to share what their experience was in navigating the dashboard, happy to hear from folks about any challenges, any questions. I did see a question in the chat, and one question was, what is the level at which we have the data? Do we have it at census tract? So this data is at the population level. So everything that we have here is making inferences to the larger Los Angeles County population of individuals aged 50 and older. So we don't have place-based data, but that question is a good one, because that is something that we've talked about in terms of, do we or should we include data at the place level? And two, thinking about where would we get that data, and how would that data be presented? Would we use maps, or what would be the way that we would present that data? So thanks so much for that question. But the data that we have now is just at the overall population level of older adults age 50 and older in Los Angeles County. Any other questions? Oh, and Siri was jumping in. So do we have raw numbers for the prevalence percentages? So I think you can download the data from the website to get the raw data, but I'm not sure if when you download that you get the prevalence data or the percentages, or if you get the raw data. So I'd have to check on that question.
Reggie,
Yeah.
you have Iveris, and after Iveris you have Kelly.
So I'm sorry, say that again, Viviana.
Iveris
Oh,
Martinez.
Iveris. Yes. Iveris. Hello.
Oh, hi. Am I presenting what we did at the breakout, or was it my question?
Your question.
Oh, okay. I was wondering, maybe I missed this in the presentation, but what is the general data source or sources?
Yep.
For the items included, and how would we cite the dashboard if we were use it in writing something?
Yep. So it is the Los Angeles County Health Survey. And I think I have it here, have the link here in my slides.
Mm-hmm. You do.
Let's see. Yes, there.
Okay.
And
And
then we
so
have,
do we cite that, or do we cite the dashboard? What is the appropriate thing to do?
You can cite both. And I think we'll have to come up with what is the citation for the data dashboard. So that'll be something that the LAACHA steering committee can create. And then make sure that we have that on the front of the landing page. That is, if this is cited, then this is the citation.
Very good. Will do. Kelly next, and Ellen follows.
There's some feedback is that the text is really tiny, like within the chart. Like I know the website lets you enlarge the text, but once you did that, it still was really tiny. And I had a hard time reading it, so I just assumed that other people did too.
Yeah.
And then I wanted to be able to like see the intersection of like If we were looking at depression, like how
Yep.
many women are caregivers and have
Yes.
depression? So that's just my feedback.
Yep.
If we could see that in the future. Thank you.
Yes. Great. Great question and great feedback in terms of thinking about, how do we enlarge the data? So we'll have to work with the IT team to sort of really sort of move around the page to figure out the ways in which we can make certain sections larger. But your question about crosstabs, that is something that we have talked about as a group. And so trying to figure out the ways in which we can do that is definitely on our list of next steps.
And our group also noted that it was like hard to initially find where we're supposed to go find the dashboard from the home page. So if AD team, if you're considering that in the future, maybe make it higher up on the page instead of all the way at the bottom.
Yeah. And when we started this process, I actually purchased a couple of domain names that might be helpful as we go forward. And so that as we move forward, sort of thinking about maybe, hosting it at a domain name that is easily recognizable for folks that need to use the dashboard. So yes, that definitely on our discussion list. Thanks, Kelly.
Ellen had a question.
Oh, Ellen?
Hi all. Actually, this isn't exactly a question. I have a couple of clarification things that might be helpful for people. Because it kept coming up as the question about, are we going to get any new data and when would we get the new data? So right now, what's on the website is our 2015-2018 data. We have just the 2022 data is now in at the LA County, the unit that works on it has completed their work on all the cleaning, all of this, all of that. But what's going to happen now is that we get the data, we can get the data, but it all takes a little bit of time. So we will have the 2022 data, which is very exciting, incredibly exciting. We'll have a chance to put in some new indicators like social isolation and loneliness, like caregiving. There's certain things that are going to be new additions that were asked on the new health survey. And so those are great pluses, but in terms of when it will actually hit the dashboard, I feel like we don't know the answer to that yet, because it all takes a while, as everybody knows. That kind of thing is so that I just wanted to say that there is that expectation is that will increase and it will be able to see trends and all of those things, but the when is not completely clear. The other thing is that what came up was, I don't know if people played with the income part of it, but what we will be able to do is to change the income, how most people would like it to, like 100% of poverty, 200% of poverty, 300%, 400%. That'll be a change again in the next round of all of this. But for right now in the data set, it's set at the 185. So that can't change for the moment. And then the other thing I was going to say was, in terms of, we don't have the level of data that the census tract data, but we do have SPA level data. So it's, but again, there has to do with how many, are the numbers going to be robust enough to be able to look at it in various ways. So all those are things for the future when we actually get a chance to see some of the, on the numbers on the new part of this. So thank you for letting me take that time.
Great. Okay. So any other questions, Viviana, before I go into my list of acknowledgements and thank yous?
No, I'm
Okay.
good here. We're doing great with time, let me tell you.
Okay, great. And so as folks are maybe thinking of additional questions or folks want us to sort of navigate other aspects of the dashboard, happy to do that. But I'd like to take a moment to thank the members of the Tucker Seeley Research Lab during my time when I was at USC. Yes, Ayoko.
Yes. Good afternoon, everyone. Thank you for this amazing presentation. And our group, I just wanted to throw a couple of notes out from our group. We're excited for the data to be there and to be able to parse it. And as Dr. Schickendanz had noted, because some of the population sizes may be small, for example, the Native American or Hawaiian, if there is a % change from 2013 to 2018, we don't know if it may be a bigger number, but it may not be statistically significant because we don't have the absolute number. So you may see a trend, but it's not actionable or really meaningful because of the lack of statistical significance information to accompany the data. But again, we acknowledge this is a start, and that more and more the data will become analysis will become more and more robust over time. And so we appreciate that. Also, I wanted to note that on the social determinants of health, housing stability is not listed. And I do believe that is a huge level of concern for our community. Indeed. Is the number of seniors that are borderline unstably housed. Indeed. And all these health indicators will plummet if we don't have stably housed seniors.
Indeed.
So if there was a way to highlight housing stability.
Yes.
Thank you.
Yep. Great. Thank you. Bernita?
We have Bernita.
Yeah. Yeah. Thank you.
Thank you.
Is there time allowed for us to be able to go through this at a speed that we can follow and then report to you? Okay, I see the question in your face.
Yeah, I'm
the group that we were in, that I was in.
Yeah,
we could not get into what was going on. We're trying to understand what was going on.
So one of the things that we talked about as we were developing the dashboard was doing community learning sessions where we would go out to the community and meet with folks and sort of walk them through the dashboard. So I think as we secure funding to do those things, then yes, that is definitely on the part of the discussion in terms of being able to provide longer trainings around how to navigate the dashboard and its use. Yeah.
Very good.
So does anyone else want to report sort of what their experience since Viviana, I wasn't sure how good we were on time, so I was trying to rush through to get to my acknowledgments and thank yous. But if we're good on time, I'd love to hear from folks in terms of what their experience was like in navigating it. So some of the things that we've heard so far is that this was really fast. And so trying to think about the ways in which we can provide an opportunity to go through it much slower, and so maybe in smaller groups. So maybe, thinking about the way in which we can do it, with smaller groups. And also in terms of being able to download the data, being able to have the absolute numbers and the percentages. And that's going to come in handy when we're also thinking about calculating disparity. So that's definitely something that we're going to look at when we are calculating those disparities. So any other comments around navigating the website? So I see two hands. Viviana, if you can help me call on folks.
Ayako?
Yep.
Oh, I'll let Darlene go first since she hasn't spoken yet.
I was just referring to what Bernita said. I think she was asking if we would be able to access it, and I was just looking. It's there that we can go and explore on our own, right?
Yes. So it is live. It is available to the public thanks to the LA County Department of Aging and Disabilities. It is on that website, so you can go to those links at any time and sort of walk around. In our previous version, it wasn't live when we've had these meetings and sort of shown you different versions, but it is live now, so you can go and navigate it at a slower pace. So if you'll give me 30 seconds, my dog is pawing on me because she has to go out to potty and I don't want her to potty in the house. So give me 30 seconds. I'll be right back.
Not a problem. Ellen, maybe you want to share with us a little bit of what the committee will be considering in terms of training?
Can people hear me? Yes. I think, Bernita, what you mentioned, I think we need to take very seriously. And I think if people could email us of anyone that wants to, we encourage everybody to play with the website, see what works, see what doesn't. But we're happy to do individualized ways that we can do it. In a small group, we can do it. to go through this, and I agree, it all happened very quickly, and some people have much more familiarity with working on these websites and some people don't. And so we want to make this accessible. That's the whole idea behind this, is we want it accessible to everyone. So please, 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 let us know if you'd like some more individualized or small group kind of training on this. And there's all kinds of questions that people have raised. The raw data question. If people get in touch with us on the side, if there's things in particular that you would like to know about the data and about how you might access, directly some of the LA County Health Survey data, et cetera, et cetera. So some of this is, it's a very exciting first step for us, but it doesn't mean that this is just literally step one. And we picked the 10 top indicators, but it doesn't mean that this is the extent of what we want to look at. So it's, if there's other particular questions, I don't know if Dr. Susie Baldwin is on, that has more expertise in terms of the actual survey itself, but I can't see it one way or the other if she is. But if there's any particular questions that relate, I might be able to answer them, but Reggie.
Yep. And two, I mean, I think Ellen's framing is perfect here. I think if we think about this as just the start, and we're just going to build it better. So these indicators that we have here, just the start. And sort of thinking about how we can grow this, what other data sources, and thinking about, and two, I apologize for the speed. I was really trying to cram in as much as possible in the limited time. But as we expand this beyond our LAACHA partners, because this is, what we hope will be useful for LAACHA, but really for the entire LA County aging community. So what are some of the ways in which we can make this more user-friendly for our LAACHA members, but also for the larger LA County community? Happy to have that feedback.
We have a couple people, Hansa, we have Ayako and Bernita next.
Yes, I just wanted to reiterate what someone said earlier about data at the SPA level. That would be very helpful. I think most of the people on the call are working on perhaps a specific geography, and funders, project plans always want data that is more specific to that local geography.
Yes.
So that's very helpful. For example, we know there are disparities in South LA, but we don't want to use LA County-wide data and apply that to South LA, right? We know there's more disparity. So if there was an easier way to get at local data, for those of us who don't have statistical management data teams to support us, it would be great to be able to suck it out of a report. But if we went to the SPA level data also, if the population, the sample sizes are too small, if there was a way for you to indicate that the sample size is too small for statistically significant results, or anything that's actionable, that would be also helpful for those of us who aren't so fluent and being able to download it ourselves and run it through SAS or something, and then find the statistical significance. So if you could dumb it down for the rest of us, how useful is that trend? That would be very helpful. Thank you.
Okay, great. All right.
Great. Bernita has her hand up.
Trying to find out what it was that I was supposed to be doing. What I did was I opened up the Department of Public Health in some symbol at the bottom of the page. And I went to that particular area. I work in the field of domestic violence. So I went to that area. I saw the domestic violence console on there with some of our latest information that we've just generated during the last 2 weeks. So that was very exciting for me. We know that domestic violence is not something that happens for individuals just between the ages of, say, 25 and 50, but it happens later in life. It happens to our children. Right. It's influencing everything that we do, and most people don't understand that. So I said, well, let me just go here and see what it says. So I was pleased. Thank you, Ellen. I was very pleased, Reggie. Thank you so much.
Well, and two, I think you and you raise a really good point in terms of figuring out what next steps are for data to include. So as Ellen mentioned, sort of the decision for these 10 health indicators was a collaborative effort in terms of the availability of data. But as we move to the next stage, trying to think about where do we have data, do we have enough, or do we have the right data for this particular source, and if not, then maybe it is just a link to, like how you just sort of found that data source that you just mentioned. If it's not something that we put in the actual data dashboard, is it just a link to where folks can find information on health outcomes that aren't necessarily included in this dashboard? Morgan, hello. So great to see you.
Hi.
So Morgan was an intern on the project. So as you see, she's one of the folks that we thank in terms of giving us feedback on the dashboard. So great to see you.
Likewise, I'm so excited to be here. Of course, I'm looking at this from a marketing perspective and a website perspective, and this might be a conversation more for the IT team and their capabilities, but looking at mobile usability, I opened it on my computer, of course, but I also looked at it on my phone, and it's just harder to navigate on the phone. Are there plans to kind of work on mobile usability in the future for this? Because that would affect iPad usage and other, devices, not just cell phones.
So I will let Ivan and his team take that question.
Yeah, that is certainly something we will take a look at and give you a better response. It's not 100% mobile, but it is. It switches to a mode where you could use it on your phone, but it may not be the best. So we may look at ways to maybe redesign it a little bit to make it more easier to navigate. So definitely that's something we can take back and explore. Yes.
Awesome.
Thank you. Dr. Chicken Dance, she has her hand up.
Hi, Dr. Chicken Dance.
Hi, Reggie Tucker Seeley. You can call me Heather.
Hi,
Heather. Thank you. I think that actually somebody else has, I can't say your name correctly, Mr. Emeka has his hand up as well.
Okay.
So my question is just similar to the sort of using the data. I do a lot of teaching, and so I was just wondering, is there a way to export a particular dashboard view as a slide? Because I tried to play with it and do that, and I really couldn't figure out a way besides making like a screenshot, which ends up being pretty poor quality.
Yes. So I think as you saw with the slide presentation that I did today, I think all we have capabilities for now are just sort of the screenshot, but that is a really great great suggestion in terms of thinking about the ways in which we can support folks that would like to use this tool in the teaching format to put that in a slide that's just ready to present. So Ellen and Viviana and Laura,
I have a comment for Sebastian and for the IT team. I thought, if I recall correctly, that there is a way to download information as a PowerPoint, as a slide presentation. I don't know if that answers the question. Ivan, Anahid, are you there?
Yeah, we're here. Viviana, I think the version that we were using was our own production development version. So it may have some features that the web version does not have.
Oh, so I see.
Let me go back with the team and see what options we have for data sharing and downloading of a specific page to see if we could create a PDF of that so that it can be used as a slide in a presentation. So we'll take that one back and research it a little bit.
Thank you so much.
All right. Thanks, Ivan.
Sure.
Emeka, you have your hand up now.
Yes. I think there is a necessity to include, data that is related to refugees, like maybe African and other, type of race who are regarded as refugees in the United States. I think that would be, it will make a big importance to include in this.
Yes, and so I think one of the things that we might be limited by is whether or not the data source has that information. So that is, you know, if the data, so remember we were going through sort of what is the question, and then, you know, what is the response options and that demographic information. If when people select race or immigrant status, if that information is there. So I think in terms of sort of next steps, trying to think about where we might get that data. And so if you have any ideas around sort of where that data lives, or where we might get data on refugee status, that would be really helpful.
Thank you. Thank you.
Thank
Maureen, you have your hand up now.
Yes, I was asking, I know the LGBTQ community was not necessarily included in there, but in the 2018 data, it showed for gender, there was a third category. So since we're collecting that third, that changed the numbers, obviously. But if we're doing that, we might want to also collect the data from the LGBT community, because they historically rate, you know, not having as much emotional and social support. So that's one thing. And I also had a question about, you know, the oldest adults. I know wherever we get the data from, often those people are not online. They don't answer, you know, they don't have Wi-Fi, so they're not really answering these surveys. So I think the data is very skewed. And yes, 24 to 18-year-olds are very lonely, but I don't think the oldest of adults were asked, because they're hard to find. So I would like to just in the future consider that data somehow, because it gives a false narrative that, oh, older adults are just doing great, and that's not true.
Yep. So I think sort of similar to the response to the last question, it's all going to depend on sort of what the data looks like that we get. So so in response to the gender question, we did include the other gender category. So if you click through and you'll notice, I don't think in 2015 other what was there, but if you click on 2018, you'll see that we did include that other gender category.
Yeah,
so
we saw that. Yeah.
Okay. Yep.
But what we didn't
for the
see
data.
was
So when we get the data, if that data also includes additional categories, then that's what will show up on the data dashboard. So if there are data sources specific for the LGBT community that we should look at, that would help us then also, because then it goes to the question that I posed in the presentation around, do we take in smaller data sets that may not necessarily be generalizable, or are we looking for data that is generalizable to the entire, and in this example, the LGBT, you know, QA+ population, and then where are those data sources? So happy to sort of have that be part of the conversation. As a gay man, I do hope that my group is represented. So yes,
exactly. Especially because we were the Pacific Islander, and there were different groups that were showing a lot. And then I thought, well, here's a demographic, a group that really skews, you know, lacks certain access, but it wasn't represented. Yet we asked that in the gender question. So I think we should somehow have a data point that shows that their responses in that. Thank you.
Thank you. Yeah.
Reggie, just a comment. I think it's important for folks to know that these are not our surveys. We're secondary users of information. It's other people. What we were looking for was surveys that are conducted on a regular basis that we would have consistent access to. So just so you know, it's not like we're asking these questions, because I just want to be very transparent with everybody that that's not what this is. We're like the second level users, not the primary reason they even collected the information. So if you know of data sources, we welcome you letting us know.
Indeed. Great. Thanks, Laura.
Jason, you have your hand up.
Can you hear me now?
Yes.
Yes.
Okay. Yeah, I'm loving what I'm seeing here. I'm relatively new to this whole format, but I wanted to find out if it's a possibility in regards to the indicators or domains that we implement the mental health disparity, you know, with our seniors. That's one thing that is, to me, it's a growing factor, you know, especially in the center where I'm at. Will that be a possibility to talk about mental illness in the future when you're adding in the indicators on this?
So we have a section for mental health now, and so that includes, I think, depression questions, and I think there's some support questions there. I'm not sure what the third one is, but we have a mental health tab, and And so those are the variables that we were able to pull in from the Los Angeles County Health Survey. So if there are other data sources that have sort of mental health variables that are, again, generalizable to the larger population, because then I think that's a balance that we'll have to make here. Is this dashboard data that we want generalizable to either, the larger LA County population, or at least to the SPA level? And then maybe for those smaller data sources that are not generalizable, maybe we can just put a link to, if you're looking for data, and on these topics, these are some sources for smaller, data that's not generalizable to the population, but can, inform your work in this area.
Of course. Okay, thank you.
Yep.
Very good.
Yep.
Bernita, do you have
Very
some
quick.
comment?
I didn't get a chance to see everything. Is there acknowledgement about the disabled community? I have a friend that's very involved in that. Not just physical disability, but hearing.
Yep.
Those types of disabilities, because that's a community also that is very much neglected in getting information.
Yep. And so in the next round, after this sort of first set of 10 health outcomes that we've included, so if we're taking in all of the information that folks are providing today to sort of inform the next round of variables that we include. And as Ellen mentioned, for the Los Angeles County Health Survey, that the new data is just in. And I haven't had a chance to look at that myself, so I'm not sure, what indicators are there, but we definitely sort of hear all of the input that's being provided here today to take into consideration the next round. And I would encourage you, if you get a note that LAACHA is meeting and we're going to talk about potential variables for the data dashboard, be at that meeting, so that then we can hear your input and we know, sort of what variables you would hope that we would be included. But one thing that I used to teach a course on measuring and reporting health disparities, and we used to always talk about, there's a wide landscape of potential variables to include, and we can't include everything. And so some of it has to be, we have to make a compromise on sort of, what variables are available and what we have space for. But hopefully we'll be able to include as much as possible of all of the, variables that folks have suggested here today.
Yeah. Thank you.
Heather, thank you so
You're
much.
welcome, Bernita.
Heather has her hand up now.
Hi, I was just sharing with my group, also, I mean, not to like undermine in any way, shape or form this work, but there's also some sources like the Neighborhood Atlas, if people haven't heard of it, that are good, that do have data sort of at the sort of more, what is it, at the zip code level that you can use for free. So I know people are looking for things at a much smaller sort of neighborhood level. So that's something that I've used a lot, the Neighborhood Atlas, you can look it up. And then I know that the US Census data from 2020 hasn't really made its way into a lot of easily accessible dashboards and things, but yeah, I mean, I think this is really powerful. And I think what for me is the most powerful is that this is our own county voices of our older adults. And I know that it's coming from the very group who's here today, and we, from public health, from Department of Aging. So I'm just thrilled that we have this tool, Reggie and everybody. I just really want to thank you.
Thank you, Heather. And I think that last point we should definitely sort of hit home. That is, we took the data from the Los Angeles County Health Survey and we pulled out the data for 50 and older. So this is the only data source that I'm aware of in LA County that gives the data just for our population of interest, that is older adults. So it's commendable, I think, to the entire team that we were able to pull this together, and we now have a data dashboard for our aging community.
I just wanted to add thank you. My apologies for coming in late. Thank you,
Hi,
Laura,
Phyllis.
for covering. Hi. But thank you, Reggie. This work is wonderful. The feedback is wonderful. And 2024 looks like it's going to be very impactful. You'll have a lot of work to do, but we're able to take this and translate it into real work.
Yes.
Right. And real research for proposals and translational research within the community.
Indeed.
And thank you, Dr. Heather, for that website, because I love to do neighborhood work and bring it down to what's going on there. So thank you. Great 2024 to everyone, and Merry Christmas. So thank you
Great.
very much.
Thanks, Phyllis.
Thank you.
And I also want to highlight Lois Angelo, who I saw in the room as well. He is when I was at USC, he was a student in my research lab. So Lois, great to see you. And again, thank you so much for all of your work in helping us get this dashboard completed. And so here are a few other students and staff that were a part of my lab: Deja McCauley, Laura Steinberg, Wei Zhao Tang, and just all the students in the lab that provided input. I want to thank the LAACHA steering committee, Viviana, Laura, Ellen, Susie, steering committee members for your input throughout this whole process. The LAACHA intern, Morgan, the Los Angeles County Aging and Disability IT department. Thank you so much for your work in moving the website from our research lab at USC to the Los Angeles County Aging and Disability website. So Ivan, Anahit, George, and Sebastian, thank you so much. And I want to recognize funding from the Los Angeles Foundation on Aging and the Edward L. Snyder Chair in Gerontology at USC for helping us to support us in creating what you saw today.
Excellent.
Yep.
Helen has her hand up, and I think she's next to help us do the evaluation and the closing on behalf of
And then here's my contact information if you have any questions for me. And I'll
Thank
turn
you.
it over to you, Ellen.
Fantastic. Thank
So-
you, Reggie.
Yes, so I'm adding my thank yous to everyone. Won't repeat the names, but thank you, especially, Phyllis as our chair, Laura as our past chair, and of course, Reggie and your whole team and the IT team. But I wanted to emphasize a couple of points. One is that making sure that nobody gets left behind on utilization of the dashboard. That to me is like a very heartfelt piece of this, is that we're more than willing to help anybody that feels like they need some extra help in navigating it. So please reach out to us. Number two is I'm recommending, that our committee, and we've already started this, have pulled together what we pick, a wide berth of kind of what are some of the new variables that we'd like to look at. For example, Bernita, the issue about disability. Yes, we we wanted to look at that. So we pulled together a broader number of variables. And then as Reggie said, that what we'd like to do is to have some kind of a group meeting, share with you what we're thinking about on some of these, and we together pick which ones are, kind of our highest priority collectively. And again, it is going to be tricky because we can't do all of it at once because it all takes some time. But, and then I wanted to say one sentence about the skewed data that Maureen mentioned, that I do believe what you said is true. And I think that's why it's, the other data sources are very important also, because you are absolutely right. It's it's a phone survey, and it is a computer survey. So that's the methods by which we are asking these questions. So I believe, you mentioned the oldest. You're probably absolutely right that, and so is there some kind of other mechanism of getting at that group that could much more be, real in terms of what we're saying about that. In general, it is a weighted survey, and it is validated in all these different ways for the data. But there's certain groups that you're probably right. But please, we ask you to please put the evaluation hopefully is in there. We're going to put the evaluation in for this. Is it Cameron that's putting it in? Please fill out the evaluation. Tell us how we could do this and other things better. What works for you, what doesn't. And then, I just have to say, this is so thrilling to me to be able to do this launch after this period of time. So thank you. You are very, very engaged, and we truly appreciate that. And we want to move forward with all of your input. So thank you from the bottom of our collective hearts here. And please do fill out the evaluation.
Ellen, how about we give everybody a couple of minutes, because that's the best way to collect feedback.
Yeah.
People had a lot of suggestions. This is the perfect time to enter that information in, have it all in one place for us to give it to the Outcomes and Evaluation Committee, Reggie, Laura, and go from there. So we have done very well today. Everybody rushed. So we have about 6 minutes. If we take a couple to complete the survey, that would be great. And then Ellen will take us to the closure. Thank you so much. Okay, Ellen, I think by now people probably have completed it.
So I have a very basic last message, wishing you all very, very, very happy holidays, safe holidays, and thank you truly for your participation today. Thank you to the LAACHA leadership, and we look forward to a very robust 2024. Thank you all very much for all of your hard work on this.
Our next meeting is in March, if I'm not mistaken, March 20th. And at that time, we plan to come back, continue discussion around the Get Ready LA pilot. We will have maybe some more conclusive information around the indicators. Ellen, perhaps we can meet in between meetings and provide a platform for our members to come together, maybe attend one of the committee meetings and be part of this process. I was very impressed by some of our participants today to be very, very interested on this topic. So maybe we can bring you in, Reggie, to facilitate the conversation. One of the things that we haven't done and we hope to do in the future is to talk about other utilities that we might have for the dashboard. The committee has begun having that conversation. And I think with all of you, we can do a very powerful group that takes this to the phase 2 next level.
Just to
Thank you to the
reiterate that part, is I meant to say that is, could you, if you're interested in actually being on the Outcomes and Evaluation Committee, you do not have to be a data expert. You do not.
No.
And if you're interested in being part of the committee, please just give us, just send us an email. That would be great. But we would like to have, anybody's feedback, even if you're not going to be on the committee. We want everybody's feedback. Thank you. Happy holidays to all. Thank you.
And thank you for coming. Excellent. Thank you so much, everyone. Happy holidays. Take care.
Excellent meeting, Reggie.
Bye.
You're my
Thank
hero.
you.
Good job, everybody.
Thank you all so much.
Bye. Have a
Thank you,
good
Bye,
everybody.
everyone.
Thank you. Bye-bye.
Bye. Great job, everyone.
Thank you,
Phyllis.
fellas.
Thank
Thank
you
you
for
for
making it.
coming. Yes, yes. Bye,
Hopefully everything was
Ayako.
okay.
Great to see you. I think you need to join the committee, Ayako.
Hello, Ayako.